All right, here we go. Last lecture of the semester. This is about pathology, but really more focusing on something called immunopathology. So, immunopathology is when we get tissue damage due to our immune response. And in reality, much of the symptoms that you feel when you're sick, some are due to the pathogen causing damage, but most of it's due to our immune response. And what you're going to see in the slides is that sometimes our immune response acts a little more than needed to clear the pathogen, and it can cause issues with our tissue. The number one cause of this is inflammation. Okay. And we'll talk about inflammation and why that's an issue. So let's look at some of the pathology. So some microbes will cause tissue damage directly. Okay, so cytopathic means killing or lysing cells. Lots of viruses do this. Okay, so in that case, the virus is directly causing the damage. It is directly killing the tissues. Okay. Sometimes the immune response is damaging the tissue. And what this is showing you is, remember that cytokines are basically cell signaling molecules of the immune system. In this case, that's what we're talking about. And when some of these immune cells get damaged, they release cytokines, the immune response kicks in and can damage tissue. And we're going to talk about that in just a second. And sometimes the damage due to the pathogen is really caused by physical blockage. Remember, we talked about elephantitis caused by the lymph being physically blocked and causing all this swelling and accumulation. So ducts can be blocked, intestines can be blocked, and these are examples of the worm. So you can imagine these are way bigger than bacteria or viruses, but even sometimes a fungal infection can grow in such a mass that it physically blocks movement of cells or movement of fluids, and that can result in tissue damage. Sometimes organisms release toxins, and in this case, these are called exotoxins, which means it's released by the pathogen. And so it's released into the system, and it can do lots of stuff. So it can kill cells, it can increase vomiting and diarrhea. We'll talk about those in a minute. It can damage both regular cells and damage parts of the immune system, like the red cells, the white cells, the leukocytes, the T cells. Okay. So what's happening, some of the reason this is happening is so that the pathogen can get to where they want to go. So they might release these toxins, and I'll show you an image of this in a minute, and it destroys some tissue so they can go deeper and they can spread. Sometimes it causes dysfunction of the immune cells, like we're talking here, and that may give the pathogen more time to reproduce because the immune system has been weakened a little bit. Diphtheria right here, and tetanus. Remember, we actually have vaccines against both of those kinds of toxins. So we can prevent some of the damage done by making a vaccine to the toxins. But of all of these ones listed, those are the only two we have. So this image from your book is just to kind of help you see what's happening. So again, the toxins are in the little blue, and it tells you what organism they're from. And, or I guess the toxins are, well, anyways, organisms in the blue releasing the toxin. So again, tissue damage allows the organism to get into deeper tissues, maybe where there are the nutrients it needs. Maybe it's a privileged site so that it can replicate there more undetected. Some toxins may cause something like diarrhea. Diarrhea is really massive water loss. This is a way for the bacteria to make sure it gets out and hopefully to a new host. Here are the two toxins we have vaccines for, and we have that because the toxin can result in paralysis. And tetanus is the one you get every 10 years because Clostridium tetani is a common soil bacterium. And this is the whole, don't step on a rusty nail, you might get tetanus. So you want to keep your tetanus vaccine against this toxin up because if you don't, it can cause paralysis by overstimulation of your neurotransmitters. Botulism, or the botulinum toxin, does just the opposite. It blocks, so it causes paralysis by not allowing nerve transmission. And this is Botox, right? So there are lots of very positive uses of Botox. For instance, it helps some people with migraines, but we also know there's cosmetic uses like to get rid of wrinkles. And so what it's doing is basically paralyzing your muscles so that you don't cause these wrinkles in your skin. So diarrhea and vomiting, super great ways for pathogens to get out of the body, right? So it helps you get rid of the pathogen so it doesn't continually replicate. And it helps the pathogen get out so it can hopefully get to a new host. And a lot of diarrhea and vomiting is caused by toxins. They damage the cells get, the cell lining gets leaky, and you get all this water coming out. This is a major cause of death in children. Dehydration. Okay, so with that massive water loss, you have the risk of becoming dehydrated. In Haiti, when they had the earthquake and they had massive cholera, it was hitting people so hard that they were dying within hours due to dehydration. Just could not get fluids into people fast enough. So diarrhea, vomiting, make sure you get water, better yet Gatorade or something with electrolytes to keep the the concentration of salts in your blood and lymph tissues at the right level. LPS, here in the little green, LPS is an endotoxin. And if you remember, this is in a lot of cell walls of gram-negative bacteria. Oops. And LPS is not released into the body until that bacteria dies. But once it is released, as you can see, it causes massive immune response. Okay, so that's why it's a very potent or very strong stimulator of the immune system, and it leads to overstimulation. Okay. So lots of different responses. So you can see it's activating white blood cells and macrophages and our mast cells and platelets. And so it's causing all of these different symptoms, such as fever, we'll talk about in a minute, low blood sugar. Hypotension means your blood pressure is getting too low, right? So that's a worry because you're not pumping blood everywhere you need to be, which can lead to shock. Vascular permeability, we'll talk in a minute, is is a part of inflammation. Vascular permeability means you got more liquid flowing, the vascular system opens up so that you can get more of these cells moving around. And DIC thrombosis stands for disseminated intravascular coagulation, DIC. What this really is overactive blood clotting all over the body, wherever this is happening. And what's interesting about this is you can get two different results. One, you can get buildup of blood clots, and that can actually clog or block a vessel, okay, and that cuts off the blood supply. That's not good. Or you can get massive removal of the blood clots, right? So your body's going, oh, we don't need this, let's take care of it. And then you can get bleeding, uncontrolled bleeding, because your clotting factors are all being used up in this overactive immune response. So DIC is something very common in more severe infections. Fever. Fever just means raised body temperature. And a high fever can vary from person to person. Oops, sorry. So I have to erase that. The reason our body temperature raises is they're trying to damage the pathogen. Okay, so denaturing the proteins by heating up the system. The problem is this is not specific to the pathogens, and so you can actually cause damage if you have a high fever too long. Right? It'll denature your own proteins as well as the pathogens. So many times we try to decrease fever. It's a very non-specific part of our immune system, but very common, right? You know you're sick when you have a fever, and that's one of the first things they ask you. Did you have a fever? Cough, sneeze, runny nose, right? On the one hand, this is a really good way to get the pathogen out. So you cough it out, your cilia is pushing it out. You sneeze, you got a runny nose. I love green snot just because to me that symbolizes, yeah, you got a pretty good infection, and when I was in grad school, I was having sinus infections all the time, and I had a doctor who really did not want me to take antibiotics, which I agreed with because I try to minimize my antibiotic usage. But after a while, if your body can't clear it up, you need some help. So I collected a whole bunch of my green mucus, brought it in a baggie to him, and he decided, yes, you have a severe infection, and gave me the antibiotic. So I don't know, it's kind of gross, but it's kind of interesting too. Interesting that the green is caused by some of the chemicals in your neutrophils. Huge issue with kids, again, is dehydration. So with all this mucus production that you're coughing up, you're sneezing, your runny nose, all this mucus actually takes a lot of water out of your body, and so you can get dehydrated. Here we go, inflammation. All right, so inflammation is part of our innate immune response. Okay, it's one of the first things that gets triggered. And what's happening in inflammation, okay, is that you're opening up the capillaries, right? So the goal of inflammation is to get the immune cells to where it needs to fight the pathogen, or sometimes inflammation, is due to just an injury. So it's there to help heal, get rid of if there's any dead tissue. So inflammation is a very common immune response to lots of different things. The classical signs are heat. So you've got all this blood flow going, right? And redness, because you have all this blood flow going. And tenderness, because you've got swelling. So you've got a lot of fluid that's pushing on these little blood vessels and pushing on the tissue. And that swelling, that increase in fluid, can cause tenderness and pain. Okay, this is one of our big symptoms of being sick. So again, the reason for inflammation is to attract the immune system cells, right, so that they can go to the site of injury and clean things up. Chronic inflammation can be very damaging, because we'll talk about in a second how our immune system can actually start to damage our own tissue. And so if you have inflammation that's chronically bringing in all this fluid and all these immune cells, you can start to get tissue damage. So we treat chronic inflammation with things like steroids, or first we try things like ibuprofen. And so what's happening, here's our immunopathology, right? So tissue damage caused by our immune system. And what's happening is when you recruit these different immune cells, some of the things that they use to attack the pathogen also can damage your own tissue, right? So like macrophages, remember, okay, they can release reactive oxygen compounds and reactive nitrogen compounds. And the point of these is to damage the pathogen, but it's not specific, right? So it can damage your tissue as well. Complement, right? Complement is recruiting some of these other immune cells, okay? The antibodies, some of these other cytokines can actually trigger damage in our own tissue because it's nonspecific, and your goal is to clear out the damaged tissue or the damaged pathogen, and sometimes this can get overactive and actually cause more damage to our cells. Kind of a the similar pathology is skin rashes. Okay, so this is again overactive immune response. And we call it hypersensitivity. Right? And you think about this with allergies. Right? Unfortunately, I somehow have developed an allergy to our little guinea pig. And so when I hold him and snuggle with him, when I'm done, my arm for a couple hours breaks out in all this rash, all these bumps. And it's just this hypersensitive response. We can also get that to pathogens. Okay? So this guy here is showing measles infection. So that's a virus. So he's reacting with this rash. This one in the middle is scarlet fever, which sometimes goes along with strep throat. And this one is leishmania, which is a protozoa, and it gets these ulcers. So our body, while it's trying to attack the pathogen, is also causing damage to us. A really, is it on here? Serious one. Not on here, but just a FYI. Myocarditis. Okay. Caused by a group A strep infection is actually our antibodies start attacking our heart tissue. Okay. So we get these autoantibodies, so like an autoimmune disease, antibodies, after this infection, and those antibodies attack the heart tissue, and that can be very, very dangerous. Another type of pathology that some microbes can cause is cancer. Right? So some microbes, viruses, but potentially the bacteria Helicobacter pylori can change our cells so that they don't respond regularly to growth signals, right? So human papillomavirus and hepatitis B, part of the vaccine is to hopefully prevent these types of cancer. So many times a human papillomavirus infection will cause nothing or cause a wart. But the cervical cancer that's caused by human papillomavirus is really the goal of the HPV vaccine. Hepatitis B also is to try to prevent liver cancer. I think that's all I wanted to say about that. And the summary slide is just to remind you that pathology or tissue damage can be due to the parasite directly, due to our immune system, or due to, part of the innate immune system, or due to the adaptive immune system, which is the hypersensitivity response. All right, so that is it from our textbook. Where we will be going next is to start reading primary literature. Please check Canvas regularly as I start to post how we will make this transition, information about your exam, but your next to-do is to do homework 4. All right, thanks. Bye.